This topic is osteomyelitis. If we break down the word osteomyelitis, we have the prefix osteo, meaning bone, followed by myel, meaning marrow, and finally the suffix itis, meaning infection or inflammation. Therefore, osteomyelitis is an infection of the bone marrow caused by a bacterium entering into the bone matrix. There are three different ways that this can happen. The first way is through an open wound or open fracture, which causes direct entry of the bacteria into the bone tissue. Second, the bacteria can enter into the bone from the bloodstream, which is a hematogenous source. And finally, adjacent tissue infection, such as from a diabetic ulcer or pressure injury, can also lead to osteomyelitis. Bacterial growth leads to inflammation and increased pressure within the bone matrix. An infection within the bone is very unique in the fact that the bone tissue is very rigid and has limited blood flow compared to other areas of the body. Continued bacterial growth increases pressure and leads to the spread of that necrosis. Eventually, draining sinuses can form, which can lead to abscess formation and increases the risk for sepsis without treatment. The image on this slide helps us to visualize this process in its entirety, from initial infection all the way up to the formation of tissue necrosis and draining sinuses. In terms of diagnostics, bone imaging through the use of X-ray, CT scan, or MRI helps us to determine the extent of infection within the bone, and the use of bone biopsy with culture helps us to identify the offending organism, which is important for antibiotic therapy later on. Risk factors include any activity that increases the risk for bloodborne infection, such as long-term use of IV catheters or IV recreational drug use, conditions that inhibit healing, such as diabetes mellitus or immunosuppressive therapy, orthopedic surgery and implanted prosthetic devices, open wounds, and sickle cell disease, which can scar the spleen and lead to decreased white blood cell counts. Clinical features are similar to other types of infection and include localized symptoms such as severe pain to the affected site, erythema and warmth, and swelling due to a localized immune response. Systemic symptoms include fever, night sweats, chills, malaise, and irritability and restlessness, which is common in children. Osteomyelitis infections can be very difficult to treat due to the limited blood flow surrounding the bone, as well as the buildup of necrotic tissue, which affects delivery of antibiotics. Therefore, it is imperative that we obtain blood cultures to determine the most appropriate antibiotic for long-term antibiotic therapy. Even with appropriate IV antibiotic therapy, resolution of the infection can take several weeks. Therefore, we should anticipate the insertion of a central venous access device, such as a peripherally inserted central catheter. For infections that are particularly difficult to treat, the client may be diagnosed with chronic osteomyelitis, which can take several months to resolve. A number of analgesics can be used to treat the client's pain, and if the client has a draining sinus, we want to make sure that we are preventing spread of infection to other parts of the body. Interventions such as wound debridement as well as sterile dressing changes will help us accomplish this. To prevent pathological fractures and additional pain, we can encourage the client to avoid weight bearing on the affected extremity. And because children in particular like to be physically active, diversional activities should be used to prevent additional harm to whatever limb is affected, whether that's in the lower or upper extremity. This can include reading, drawing, and puzzles, and if an upper extremity is affected, making sure the child is using the opposite arm. Additionally, we may consider the use of a temporary splint to avoid further harm.